Hello, good evening, Dr. Tsetan. How do you pronounce your name?
Tsetan.
Tsetan.
Yeah.
Very good. Thank you for coming and talking with the Arcturus Clinic this evening.
Okay.
So you're going to come and work in our clinic on a 2 or 3 monthly basis as you travel around Europe. So welcome to our team.
Yeah.
Just wanted to ask you a few questions. First of all, could you share with us a little bit about your history? When did you first study Tibetan medicine, and how did you become as accomplished as you are now?
Well, okay, I was born in Tibet, and then in the family of my generation from maybe 10th, 11th century, they carry and they brought to my family, and then I start living or with the family of medicine. And then after I finished my school, actually my aim is to be a physical teacher or physical education teacher. That's what I like, but still my parents or the family, they want me to go through this traditional. So I have to again pick up again later when I finish my university. So after that, then since last 27 years, I'm working for this in the West, practicing. Before I practiced maybe 7-8 years in Nepal, and then after practicing in Europe for Germany, France, England, or some Belgium and Swiss and Spain also.
Excellent, thank you. So you've got plans to bring Tibetan medicine more to Europe. You've got some medicine factory in Nepal. Is that your?
Yeah, we have a clinic and we have producing medicine things in Nepal. I don't think I can bring the medicine but to promote to kind of the system of curing to the West, because in somewhere alternate it need and necessary. So for this, I think it's beneficial for this being is the medicine. Was to doctors, the aim is to achieve for the patient to cure, and that's is the like a dharma for us.
Yeah, a dharma is your practice, your spiritual practice.
Yeah. So this is practical practice, to cure something which has problem. Is the real practice.
Yeah.
Of the present life.
So you're putting your Tibetan Buddhist compassion practice into action.
Yes. In the medicine, what we need is love and compassion. And when you have love and compassion, the first thing is most important is that every passion is like your mother, and mother is the most important.
Yeah.
So when you take care of them like a mother, and naturally, with compassion it works. Then medicine, then your method. So the most important is love and compassion.
So that's your primary state of consciousness then?
Yes.
And then that manifests in form.
Manifest. When you don't have this, then it doesn't work, because when you have no compassion, if you are the best medicine doctor, it doesn't work. When you have compassion, if you are not the best, but still it could work because of your love.
That's very good. So when patients come and see you here in the West, you take a history of what's wrong with them, but then you spend a lot of time feeling their pulse, and you feel my pulse for like 5 minutes or something, which is amazing.
Yeah.
Can you share a little bit about what you're doing when you feel the pulse? What's actually going on?
Looking all the organs, the systems, the movement of the organ, and also in the beginning, first we see is the passion movement when they enter and approach and then their way of expression, and then we check to the pulse. And when we don't understand fully the pulse, then you ask for the history and communicate.
Yeah. Yeah, I find that in Chinese medicine, you look at the tongue and we take the pulse, and you can take a history and you think, oh, maybe this is going on, and then you look at the tongue and you think, oh no, that doesn't quite fit, so then you have to go back and ask some more questions and listen to what the body is saying.
First the impression, first even to look how you approach, how you enter from the door, and then your presence, and then your way of the vocal, and then you look, observe to the eye, to also when you don't find really many things, then you go to the urinary